Alrighty, well, welcome and thank you for joining today's Medicare member webinar. My name is Ryan Dolan. I'm the Medicare Field Sales Manager here at Excellus. Been with the organization for about 11 years, all in the Medicare capacity. And I'll be kicking things off here. I'll be moderating the event, so I'll lead us off with a couple housekeeping notes, and then you'll see me pop in here at the end for some quick Q&A as long as time allows for it. And I'll also finish out here with a quick close. So happy to have everyone here today. Just a reminder, today's event is designed for individual Medicare Advantage members. If you receive your Medicare plan through a current or former employer, certainly welcome to listen in. Some of the benefits may overlap, but know that the plans are different between the group as well as individual products. Over the next hour, we're going to help you learn more about your Medicare Advantage plan benefits, including medical, dental, vision, pharmacy. May want to grab a pen and paper. There's a lot of content. We have 4 great presenters here that are going to give you a lot of information over the next hour. Before we get started, you will notice that for your privacy, your mics are muted and your cameras are off. If time allows for it, we'll definitely build in some Q&A. At the top of your Teams link here, you will see a Q&A section. I do recommend having that chat function open. Again, if you have questions, you can drop them in the chat throughout. But Wendy's also going to be behind the scenes here, and she's going to be adding in some helpful information. So quick links, things like our provider directory, maybe information on Silver and Fit, which we're going to dive into. So going to be helpful for you to have that open and be able to reference throughout. But no, if you do have questions, that come up and we don't get to it today, or something you think of after the event ends, you will receive an email where you can request additional support. This session will also be recorded and available online within the next couple of days to reference. So next, I'd like to introduce you to our panelist speakers for today's virtual webinar. Leading us off is Tim Shadle. He is a Medicare consultant, been with the organization for over 18 years, resides in Skaneateles, and he has 2 children in college. Next, we'll have Sarah Wise, who is a Medicare product manager. In her role, she is responsible for guiding strategy for the Medicare line of business. Sarah has been with us for 3 years. She also lives here in the beautiful state of New York, and she resides with her husband and 3 furry family members. We have Dr. Ankit Garg. He is a practicing internist and vice president of medical affairs. He's been with the organization for just over 3 years, resides with his wife and 3 children in the town of Pittsburgh. Last but certainly not least, we have Danielle Benunzik. She is a clinical pharmacist and our Medicare Part D formulary manager. So she manages that formulary that's detailed for you guys. In her role, she helps develop and maintain the covered prescription drug list and follows all CMS regulatory requirements. She's been with the organization for over 12 years. She's a lifelong resident of Western New York, residing in Clarence Center with her husband, son, and 7-year-old Kavapu named Turk. She's also an avid Buffalo Bills fan. So go Bills. And with that, I will turn it over to Tim. Take it away, Tim.
Thank you, Ryan. And thank you everyone for joining, whether you came aboard with Excellus a couple months ago or you've been with us for years. We are grateful. So let me start by giving you a brief history of Excellus BlueCross BlueShield. Excellus BlueCross BlueShield formed in 1932 and has been serving our communities and members for over 90 years. Some companies come and go, but we have really established our roots here. We are active in the local community and employ about 5,000 New York residents. We are an established nonprofit company and we operate in 31 counties and serve over 1.5 million members. We don't just live and work in our communities, we work to make them better. Excellus BlueCross BlueShield encourages employees to donate their time and service to nonprofit organizations across our service area. Now, before I go on, we want to say thank you to our members for rating us #1 in New York again. For the second consecutive year, J.D. Power has ranked Excellus BlueCross BlueShield tops in New York for Medicare Advantage plan customer satisfaction and most trusted. This wouldn't be possible without our local employees who are committed to providing excellent service for our members, who have recognized us for our coverage and ease of doing business. There are lots of resources available to you for support and understanding your plan and benefits. Perhaps your broker, if you have one, or an Excellus Medicare consultant like myself. We're here all year long, not just when you enroll or at the beginning of the year. We also have our customer care team. They're available and willing to help you out with any questions you have Monday through Friday from 8 a.m. to 8 p.m. And from October through March, you can call on the weekend as well. You can also stop in and visit us at one of our resource centers. We have 3 resource centers across our footprint, one in Greece, one in Johnson City, and one in New Hartford. And this summer, we're fully anticipating opening a brand new resource center in Liverpool at the Glen Crossing Plaza on Route 57. So that's exciting. All right, so when can I enroll? Right now, today it's February 27th. We are in what's called the Medicare Advantage open enrollment period. This is where you can switch your Medicare Advantage plan from one to another, or perhaps you'd like to revert back to original Medicare. We also have the annual election period every fall. So there are opportunities to make changes if you see fit. There's a lot of information we will review during this virtual session, but my job is really to provide you with the confidence, security, and peace of mind that comes with making the right decision about your health insurance. We continue to invest in our plans, coverage, and extras to ensure that a quality plan is accessible and affordable to everyone in the community that we serve. 2025 is no different. Some of the valuable benefits we continue to offer for this year include PPO plans with access to doctors nationwide, plans with a Part B buyback option, and affordable. And we also have the Part D coverage gap that's been eliminated in 2025. So now members will have an out-of-pocket maximum of $2,000 when it comes to prescription costs. Let's briefly cover the differences between an HMO plan and a PPO plan. With an HMO plan, you must have a primary care physician. Making sure that one health professional has the whole picture of your health is important. Having a primary care physician to coordinate all your health care needs can be key to maintaining your health. And you do have to have referrals. Having a referral to a specialist helps to ensure that your primary care physician is part of coordinating your health care. These are kept on file, so you only need to get the referral one time per specialist. You have a network of providers that have partnered with the plan to provide your care. Most services will have copays. Then there's PPO plans. PPO plan does not require a primary care physician or referrals for specialist visits. Out-of-network services are available, although using services in-network generally cost less than those out-of-network. When it comes to guarding your health and well-being, we believe you shouldn't have to compromise. When you enroll in an Excellus BCBS Medicare Advantage plan, you get all of the benefits of original Medicare, like your Welcome to Medicare wellness visit and preventative care, covered at no additional cost to you. In addition, you get extras and allowances to ensure that everyone has access to a Medicare plan with a unique mix of coverage that makes sense for you. You can be confident in your decision knowing that all of these benefits will be included in your Excellus BlueCross BlueShield Medicare Advantage plan, no matter which one you choose. Take advantage of the preventative vaccines. Make sure you get your flu shot, your pneumonia vaccination, your COVID-19 vaccination. Get the Shingrix to guard against shingles. Take advantage of our zero-cost preventative and comprehensive dental. Take advantage of no-charge hearing and vision exams. Most of our plans have an over-the-counter allowance. You can receive at least $30 a quarter to spend on over-the-counter health and wellness items. Typically receive a catalog that you can order from. Get items like aspirin or vitamins or cold and cough medications, bandages, and more, all of which can be delivered right to your preferred address. Take advantage of telehealth. Excellus BlueCross BlueShield via our partner MD Live offers you the ability to receive on-demand access to affordable, quality health care anytime, anywhere by using our telehealth service. You can contact a network doctor by video conference or phone. This can be a convenient option for non-emergency medical conditions right from your home or while traveling, and the cost is the same as a typical visit to the doctor. If you have diabetes, we offer Part B diabetic monitoring supplies. Members can obtain a $5 Part B diabetic monitoring supply, including glucose monitors and test strips. We have a new fitness vendor called Fit On Health for 2025. We'll be talking about that in more detail just shortly here throughout the presentation. Also, we have our WellVie My Surgery program. WellVie is an easy-to-use online decision support tool which can help members decide on, prepare for, and recover from surgery. The program illustrates how a member can work with their doctor to confirm they have the correct diagnosis, explore their treatment options, prepare for, and recover from surgery, if surgery is the right choice. I recently had a surgery and I was curious what to anticipate, what to expect afterward, and WellVie definitely helped me explore and anticipate. We have worldwide urgent care and emergency care, so you have the peace of mind when you're traveling. You know that if something comes up unexpected, you will be covered. You can get more information at excellusbcbs.com/Medicare-coverage. All right, we have some additional benefits being offered on our plans in 2025. One of them is called REACH. This is a health education benefit for members who have stage 4 or 5 kidney disease. The goal of the education program is to prolong kidney function, decrease the progression of chronic kidney disease, and enable engaged members requiring and selecting renal replacement therapy to experience an optimal transition. We also have VORI Health, an enhanced disease management benefit for members who have a muscular skeletal disease problem. And think about it, that goes a long way for a lot of people. The management program is designed to limit pain and member frustration, eliminate unnecessary opioid usage, unnecessary procedures and surgeries, reoperations, and surgical complications by using a whole person, personalized care approach. We also have WellBe. This is a comprehensive in-home medical care for members with complex disease challenges. Members considered for WellBe have 7 or more chronic conditions that are often complex in nature, use 12 or more medications to manage their health, experience frequent emergency department visits and or hospital admissions, or have unique behavioral health and social support needs. It is offered to our Medicare Advantage plan members currently. A member cannot refer themselves to the program, and the health plan really does the work for you to identify whether you're fitted for the program. Members who are eligible to receive a $30 gift card for completing an in-home health visit is something else you can take advantage of. All right, let's talk about the preventative dental a little bit, the comprehensive dental. In 2025, all plans will continue to include preventative dental services without a copay. Preventative services include up to 2 exams and cleanings. How about that? Per calendar year, along with 1 type of x-ray per calendar year. And we also have the comprehensive coverage for coverage beyond preventative services. Maybe you need a crown or a root canal or a filling. We have $1,000 to help you pay for that. And that can be used whether the dentist participates or not. Please note there is no dental deductible to meet, And the dental plans will utilize the Excellus BlueCross BlueShield dental network and fee schedule. It's probably worth noting that there is no coverage for implants. Take advantage of our hearing and vision benefits. Routine hearing exam, no charge. Routine vision exam, no charge. It's important to stay on top of these things. We have eyewear allowances on most plans. We have a hearing aid program through True Hearing, where you can get a hearing aid for each year at $4.99 a piece for our advanced model, or $7.99 per ear on our premium model. TrueHearing.com, TRUHearing.com for lots of information, and they'll bend over backwards to make your experience positive. How many people have an online account? Well, I don't need you to answer that, but hopefully you do. Because when you sign up for an Excellus BlueCross BlueShield online member account, you get access to a variety of tools and resources to make healthy living a little easier. Creating an online account will allow you to pay a bill, view claims, estimate your medical costs, find a doctor or a dentist, view your benefit summary, view your member ID card in a digital form, and download statements and forms. You can create this account in 5 easy steps. I've done it. I've got it on my phone. It's wonderful. It's at my fingertips. Go to excellusmedicarebcbs.com, create a new account, complete the form, choose your username and password. Be sure to write that down, and then verify your email address. It's easy, and I highly encourage it. Now I'd like to turn it over to Sarah. So thank you.
Hi, everyone. It is great to be able to speak to you today about our new fitness vendor for 2025, FitOn. The great thing about this change to a new vendor is that so much of what you love about your fitness benefit from last year stays the same. You still receive this benefit at no cost to you. You also have access to thousands of fitness facilities, just as you did before. However, with the new vendor, there are some additional perks that if you'd like to take advantage of, you can. And these include access to fitness classes like yoga, at-home fitness items like dumbbells, unlimited access to FitOn's online content. And they have so much out there, even like recipes, a lot of great stuff out there, and an out-of-network benefit as well. So on these next two slides, just to help you better understand what FitOn can offer you, we have a few examples of how you might want to utilize your fitness benefit. So on this first slide, we have David. So David used his fitness benefit through Silver and Fit to get a membership at the YMCA. And he just really loves going to the YMCA, and that's all he wants to do. The good news for him is he doesn't have to do anything to keep his membership active. So David should have received a letter from FitOn confirming the transfer of his membership from Silver and Fit to FitOn. And this means that he is all set up to continue going to the Y uninterrupted. Now, if he didn't receive that letter, that's okay. He can also go set up a FitOn account and enroll into the YMCA or any other membership that he would like within his credit allotment. And we'll get to the account setup and more about credits in the next few slides. Now, our next person is Maria. Now, Maria, she's a new member and she's really excited about this benefit option and just wants to see what all it has to offer. So she signs up for a FitOn account, selects her local gym that she enjoys going to for a monthly membership. Credits for that gym will be deducted automatically based on the gym that she selected. So that's just like the number of credits that each gym costs. So Maria is also, like I said, interested in taking full advantage of this benefit. So she wants to try out some classes. On the Fit On site, she is able to view classes and can find one that fits within her credit allotment. There are also free online classes and resources that she can take advantage of. Like I said, there's a lot of great content out there. And then next, we'll be going into the credit system that FitOn works off of. So we know that the credit system is a little bit different. So wanted to walk through that today and give you a feel of an example of how it works. So all of our members get 36 credits each month to use on fitness activities. These are automatically loaded every month onto your account, so you don't need to do anything. But do know that they do not roll over. So you'll want to use as many of those as you like, but just know that they do not roll over to the next month. So let's look at Maria and what she wants to do. Like we said, like she's just wanting to use this to the fullness. um, but Maria selects a gym membership that costs 20 credits per month. Those 20 credits will be deducted monthly unless she cancels a membership. So do keep that in mind. When you enroll into a membership, it will automatically renew each month until you go back in and cancel it. So after that, she has 16 credits remaining that she can use for other things. So she decides that she wants to take that yoga class and sees it costs 8 credits. So she registers and attends. And then those 8 credits are deducted, and she has 8 credits left. And like I said, there's a lot of online content that she decides that she wants to take advantage of. She does some meditation videos and some short online classes that are out on the FitOn platform. And the great thing is all the stuff online, like those classes, the recipes, and other items are free for members to utilize, no credit deductions. So Maria loved that yoga class. She's so glad she tried something new. And she decides to take another one. And her account will be then deducted that other 8 credits. And so that leaves her, she's utilized all her credits for that month. But the next month, she'll be refreshed with those 36 credits, again, minus the 20 for that gym membership if she chooses to keep that membership. So the next few slides that we'll be going into is account setup. So for the account setup, there are quite a few steps, but don't get overwhelmed by that. You only have to go through a lot of these steps just once just to get your account set up. So first, you'll want to access your FitOn account by logging into your Excellus member portal. And from there, you'll go through a few steps to navigate to the FitOn member portal. Do note that as you're going through this, you should start out by having your member ID handy, as you will want to match your information from there for the FitOn registration, just to make sure it's a successful registration. So again, just navigating through these screens. And then through those, after you get through those initial screens, you'll get to where you'll be setting up your FitOn account. From here, let's go to the first screen. So there'll be an initial screen to enter in your email and password. We recommend, just because I know everybody has so many passwords out there, we recommend using the same information you use for Excellus member portal, just for easy memory. You will also be able to use these credentials if you want to use the FitOn app, but do know that you have to complete registration all the way before you can use the app. So on the next screen, this screen is where you'll want to pull out your member ID and have that handy. So you'll want to match the name on your ID to the name that you enter into these fields, and also the zip code that you receive mailings from us from. Now, a lot of these personalization questions are, estimates. So like, well, back on this one, your weight and height, just provide an estimate. It doesn't have to be exact. All these personalization questions are just for you to have the best fit-on experience with your account. So again, more personalization questions. Again, make sure that you click through all of these and just answer as best as you can. Again, doesn't need to be exact, so we'll just go through these screens. And then after you've made it through all those screens, again, I know there's quite a few, but you'll only have to go through that one time. You're actually set up with your fit-on count. So from there, you can join a gym, attend a class, or utilize, like I said, there's so much content out there. So be sure to utilize it if you can. Um, so we realize that, you might need help, and that's why we're here. So we're here anytime that you need us. We at Excellus are here to help with your registration of your Excellus account. If you have any issues, or if you need help with your fit-on registration, we have people at fit-on that are well equipped to help you with your registration, selecting a gym, or any other questions that you might have about the fit-on platform or anything you want to do with that benefit. So that concludes the part of the fit-on presentation. But at this time, I'll pass along to the presentation to Dr. Garg for him to discuss preventative care with everyone. Thank you.
Thank you, Sarah, and thank you everyone for joining. Some of you who may have attended last year's webinar, I did present last year as well, and welcome back to those. So I'm Dr. Garg. I'm a practicing internist here in Rochester, board certified in internal medicine, and I would love to talk to you guys about, how you can get ahead in your health journey this year. First of all, I want to touch on the annual care visit. I think that is the single most important thing that you can schedule right now to, kickstart your health journey. Now, there's always like, confusion about like what's a wellness visit, what's a physical exam, and there's also a third type of visit, which is a new to Medicare. I think like, these are all mostly how your physician is going to bill us. But I just want to go and touch on them a little bit. While a wellness visit is more of a preventive visit where you and your provider work together to create a long-term plan to help you keep healthy. They're going to go through your medical history, surgical history, family history, vaccination, what all medications you might have, and what all vaccines or prevention care, screenings you might be eligible for. There is no physical exam in the wellness visit, and same thing with the new to Medicare visit as well. It's just more of a reconciliation of your health journey in the past and also creating a future plan, whereas a physical exam is more of a hands-on um, exam of your body to check general health and look for any potential problems. There may or may not be a copay depending on, if you require any further tests or screenings during your visit. So that's, sometimes can be a surprise. But be rest assured that a wellness exam and a new to Medicare exam is always covered in full. A physical exam, you may or may not get a copay or a deductible depending on, how your provider bills for those tests or screenings during your visit. Now, moving on to what else you can do this year. So preventive care, there are different types of screenings. There are screenings for cancers, and there is screening for medical conditions. Cancer, some of the common cancers, colorectal cancer, prostate cancer, and for women, it's breast cancer, and of course, your cervical cancer. So there are things that your physician is going to recommend. For example, like for colorectal cancer, The most common way that you're going to be tested is probably scheduling a colonoscopy. Some people may or may not, like the invasive piece of it because it actually requires a camera to be inserted. Um, um, there are non-invasive ways, where you can get tested for colorectal cancer by just testing your stool. So just talk to your physician about what's right for you, and that's just one example. Some of the medical conditions that your provider is going to test you during these visits is testing for diabetes, testing for osteoporosis, which is thinning of your bones. It's a very common condition as you age. And really, really important to know the bone health of your body, because it's one of the things that you don't think about. And then, of course, your blood pressure, your cholesterol, thyroid, like some of those common things. Next up on the screen is immunization. Again, immunization saves lives, and most importantly, they're all covered in full. So some of the immunizations, flu shot, a pneumonia shot, a shingles vaccine, depending on, if you're eligible for it or not. And then, there are some other types of cancer screenings recommended depending on for example, like a lung cancer screening. So if you have been a smoker in the past, you may be eligible for that. So all of those things, all of the, these medical conditions that I just discussed are really important for you to get ahead of them, because the earlier you're going to be able to diagnose them, um, your condition might be still in a state where it hasn't done a lot of damage, or if it's a cancer, it may be in a condition where you can completely cure it. So just the earlier that you know, the better it is. Now, once you schedule that visit with your primary care provider, what else can you do to prepare yourself for that visit? Um, Now, I know for my patients, I always encourage them to bring all of their medications. Just I have seen a lot of surprises over the years. Some of the patients, they continue some of the medications which may have been discontinued, or they might be on a wrong dosage, or there might be a difficulty in understanding, that what medication was to be taken at what time. It is always a best practice to just bring all your medications to your appointments. The next thing is, as you see on the screen, is these are some of the uncomfortable topics that you may not want to bring up during your conversations, because you feel uncomfortable, you feel like they are going to be not necessarily very comfortable for you to talk about, but it is really important. And I'm going to just, go through each one of them one by one. Um, Memory, for example, there is dementia, and then there is, age-related memory changes. So you may be getting into, this, age where if you're forgetting your key, or, you're forgetting the contact of a person, and you may be just brushing it off as something related to your age. But it is really important to kind of just like mention it to your provider, because there are screening tests, which are basically a series of questions that your provider can do to differentiate it from dementia, something like Alzheimer's. And it's important because for something like Alzheimer's, there are treatment available, and you can delay the progression of the disease, and maximize, your quality of life. Next up on the screen is falls. Again, if you're dizzy, if you're feeling weak, it may be a little embarrassing to mention it. Um, Especially, sometimes you have this notion in the back of your mind that my driving privileges might be taken away or something like that if I mention it. But again, it's really, really important to mention it, because it may be a sign of a cardiac issue that you might be having, or if you're having some weakness in your lower body joints, maybe few sessions with physical therapy are going to be able to correct it. Or in fact, like if you're having a side effect of one of the medications, then your provider can quickly and easily fix it. And you don't want yourself to get into a situation where you fall and then you break something and then you have to present to the emergency room, because that's I've just seen too many cases that way. And then once you break something, it just takes a really really long time to recover from something like that. Next up on the screen is incontinence. Again, very common. I would say somewhat more common in women. Um, and it's really important to discuss it with your provider. There are, pelvic health exercises that you can do to be able to strengthen. And in fact, if you do require a specialist to be able to correct, some of the things related to incontinence, you might be having a prolapse, or there are other variety of conditions that may be contributing to your incontinence. It's really important to discuss that. And lastly, up on the screen is mental health. There is a lot of discussion about loneliness. In fact, our previous Surgeon General had declared loneliness as an epidemic. And it's more common in older adults. And sometimes, there are strategies that your provider might be able to tell you to be able to and overcome loneliness. But then also it's important to differentiate it from something like a depression, where you can have medications and counseling, and can get ahead of that. One of the other things about preparing yourself for the visit is, creating a list of questions that you might have. They may be related to some of these uncomfortable topics listed here, or otherwise, just feel free to put in or create an entire list. You may or may not be able to get over the entire list with your physician, but at least they can take a look at the list and be able to say that, okay, this seems important from my perspective, and at least I can go over that and answer and create a plan to address it. And then some of the other things may or may not get addressed, and you can discuss those, either through a communication with them, through a digital portal, or set up another appointment. Now, how to go about finding a provider? I think we've already discussed during the presentation that we can go online. If you've already created your online account, you just need to be able to search, use the search function, and and put in which kind of provider you're trying to find. If it's a primary care physician, you would be able to get their contact information in there. And then again, if some of you still prefer the old way of communicating by picking up the phone, you can call our customer care Monday to Friday, and during the open enrollment period, they're available on the weekends as well. And I have communicated with them for my personal health questions. They're absolutely wonderful, and they send you a whole list of providers that may match your requirements on directly to your email. At least that was my experience when I had called them earlier. So there is those two options for you. Now, this may or may not, you may or may not be aware that we have care managers or within Excellus. And believe it or not, it's a big team which is completely employed by us just for you, and it is available at no additional cost to you. This team has registered nurses, social workers, dietitians, behavioral health care managers, physical therapists. And they're all located within the upstate New York region. So if you're, going through a crisis, or if you just want to, connect with them, about a particular question that you might have regarding your individual medical situation, or if you're I'll give you an example, like if you have and if you are one of the newly diagnosed diabetics, or if you have been diagnosed with hypertension recently, then you can call this number that you see on screen, and they'll be able to connect you with a dietitian who can help you create a diet chart and help manage your condition. Some of the other use cases or examples of how you can use them is if you're struggling from multiple chronic conditions. These nurses, these care managers are really skilled in helping you navigate through those kind of situations. And then, of course, if you're struggling from something more serious like a substance use disorder or a mental illness, our behavioral health care managers might be able to help you with counseling and connecting you with the right provider as well. So that's all from my side. I'm gonna pass it on to our pharmacist, and thank you for joining again.
Thank you, Dr. Garg, for all that great information. Hey, I just want to touch on some of the topics on how your prescription drug coverage works and explain more about the phases of the benefit, phases of coverage, as well as explain some of the changes that have occurred in 2025 to your Part D benefit. This might be why you might pay $10 to $14 for your Tier 2 drug one month, and then it's $0 another month. This could be why. Uh, One great thing for 2025 is members now have a maximum out of pocket of $2,000 for your Part D drugs. That means you will pay no more than $2,000 this calendar year. It resets annually, so every January 1st. We're finding most of our members may not actually hit that maximum amount, but you could be rest assured to know that you will pay no more than $2,000 in the calendar year. So when looking at the phases of the benefit, there are 3 phases now. There's a deductible phase, and if you selected an Excellus plan that has a deductible for your prescriptions, the deductible must be met prior to moving into the initial phase. That means that you're responsible for 100% of the cost of your prescriptions until the deductible is met. Just a caveat, not all drugs require a deductible, such as the $0 vaccines, or most of our plans, Tier 1 and Tier 2 drugs, the deductible does not apply. Once the deductible is met, if applicable to your plan, you move into the initial phase. And this is where you make your copayment or your coinsurance based on the tier level of your drug. And when you or others on your behalf have made payments towards that $2,000 maximum out of pocket, you enter the catastrophic phase. In 2024, so last year, the next level would have been the coverage gap phase or donut hole. However, the coverage gap phase has been eliminated. That was due to Inflation Reduction Act laws that were implemented back in 2022. So the coverage gap phase is gone, no more donut hole, and members will not pay anything beyond their $2,000 max. So once you do hit that $2,000 max, if you actually do, you would move into the catastrophic phase. Previously, a member would have entered the catastrophic phase, once you met your out-of-pocket limit in the coverage gap, but without that, now you just move right in to the catastrophic phase. And as in 2024, members still have a $0 cost share in the catastrophic phase. So once you are in the catastrophic phase, you remain there for the rest of the calendar year, and all your prescriptions will be at no charge. If you're taking a number of prescription drugs, we can sit with you and look up the cost of each of these drugs and kind of get a running total and estimate for you when you might get out of the initial phase and when you might hit the catastrophic phase. Just have to move my slide deck over. There we go. I went too far. There we go. Things. Next slide on formulary changes. What is a formulary? It is a list of covered prescription medications. And every year, changes are made to this list. Some medications may change tiers, some will cost more or less, or be added or removed from the previous year. And then obviously new drugs come out every week, pretty much. And we have to review them and assess if they're appropriate to add to the formulary for that year. We always encourage our members to check the formulary. You can do so by clicking on the website, and there's examples of how to look for it on the slide deck. Under the prescriptions tab, there is a box called Check Drug Lists. From there, you can view the print formulary in PDF version for your specific plan, such as Blue Choice Select or Blue Essential, or you can even click on the searchable drug link list, and that takes you to a page where you can type in your drug and see if it's covered or not. That's the difference, because when you look on the PDF, if you click on it and you're looking for Lipitor, you won't find it because we don't cover brand name Lipitor anymore at the moment. But if you were to look on the searchable drug link, you can type in Lipitor and it would show you that it is non-formulary. While you're in the searchable drug link, you can also see if there's any requirements, such as a quantity limit, or if there's a prior authorization that's required. And you can also see if there's alternatives in a lower tier. So on the same page of the formulary changes here, you can scroll to the bottom and see if there's been what changes have occurred recently. So it highlights things that have changed in the last month or two. You can also call customer service and have a copy of the formulary sent to you. But just know that it does change pretty much monthly with new drugs being added. So if customer service does send you a copy, please refer back to the online website, which is updated in real time. Things you can still count on. We still have $0 tier 1 generic drugs. Let you know that we have not changed that whatsoever. It is $0 at preferred pharmacies, which I will get into on another slide. The preventative care vaccines that fall under your Part D benefit, such as Shingrix for shingles, or the RSV vaccines like Arexvy or Brisvo, those will all still be $0. And obviously, your preventative vaccines, such as your flu or pneumonia, if you need it, those are also covered in full at no cost to you. Same thing, there's been no change to the insulin costs. Their Inflation Reduction Act law I spoke about before puts a cap on no more than $35 per 30-day supply of insulin. Most of our plans, you pay much less. You pay $25 to $30, and you do get a benefit if you get a 3-month supply because you get to save a copay. Here on this slide, the pharmacy network. The takeaway here is that there's actually no change from last year. Members have options when they want to, how they want to receive their drugs. Excellus is maintaining what we call a preferred pharmacy network. What does that mean for you? That means that you can pick up your prescriptions at any of the 66,000 participating pharmacies we have nationwide. 35,000 of those 66,000 are considered preferred pharmacy chains. What does that mean? When using preferred pharmacies, members experience an average of a $5 per month in copay savings per drug versus filling it at a standard pharmacy network. Preferred pharmacies include most chains, including Wegmans, Walmart, Walgreens, Tops, some independent pharmacies. And then our standard network, again, has more, some other grocery stores outside the Western New York area, along with CVS. And then again, members also have the ability to have their prescriptions mailed to their home from either Wegmans mail order or Express Scripts. I kind of like that option some days, especially in the winter when it's cold and snowy. And checking our time, I'm going to go through these kind of quickly. It's really important to let you know that there's extra help available for your prescription costs. We know medications are pricey, They are going up every single year, greater than inflation rates. There's state help, like through the New York State EPIC program. There's federal help from Social Security office. There's help from the Veterans Administration for qualified veterans. I will say, especially if you are a New York State resident and 65 years or older, I encourage everyone to apply for EPIC. There's no cost to do so, and you get quite a few extra benefits. One, depending on the income level of your family, you can get lower prescription copay amounts per month. You can get a benefit premium deductions, and you get that special election period that allows you to change your plan throughout the year that Tim referred to in the beginning, if you need to change. From the federal government, you can call 1-800-MEDICARE or the Social Security office as well to see if you qualify. Those are for more lower income limits. There, I do want to spend some time on this slide because this is new for a lot of people, in the Medicare prescription payment plan. So even though you'll have a maximum out of pocket of $2,000, it's still a lot of money. I know I don't want to come up with that much money at once. So what is this program? It's a voluntary opt-in program that allows you to budget your prescription costs throughout the calendar year. This program may benefit you if you take a higher cost Part D drug, such as drugs for rheumatoid arthritis or multiple sclerosis. You may be likely to benefit if you know you're going to hit the $2,000 annual out-of-pocket max before like end of summer, and you just really want to spread your cost out throughout the year. The program may not be right for you if your yearly drug costs are low or the same each month. So if you pay $5 or $10 each month, you're already spreading your cost out that way. On the slide, I want to refer to you, it shows you where to look on the website. Under the prescription tab, there is the Medicare prescription payment plan link. This has great information. It shows you can self-service. It can estimate your payments. You can opt in to the program that way. There's great frequently asked questions there. It actually has a fact sheet that came directly from Medicare with, again, frequently asked questions, examples how the bill is calculated. It has examples of if you opted in or opted out with some where your dollar amounts would be each month. So I highly encourage that you go check that out. Medication adherence tips. We really want you to take your medications as prescribed. There's what's going to make you healthier. Okay. What's some of the ways to help you remember to take your meds? Use one of those 7-day pill boxes. I do, just because I forget by noon. Did I take my medicine this morning? And I can look in my Thursday box and see like, oh, they're gone. Yep, I did take it. You can set an alarm on your phone to remind you. You can fill a 90-day supply, which is great because the drug will already be in your home. And for most of your plans, you pay one copay for a 30-day supply or only 2 copays for a 90-day supply. So you're saving money there. If you're not taking your medications due to side effects, there may be another medication that you could try or a different way to take it or a different time of day to take it. And if you're not taking it because you just can't afford it, it's very expensive, we can do the things like trying to see if you qualify for extra help, EPIC, joining the prescription payment plan to budget your costs. You can use a preferred pharmacy if not already using one. And you can also ask one of our pharmacists. On our website, under that prescription tab, again, there's a lot of great information there. There's something called Ask the Pharmacist. And that actually, you can send a question right into us, and we will respond usually within 1 business day. Last, medication therapy management. What is that? If you receive this letter, you are eligible for our MTM program, or medication therapy management. What happens is if you're eligible, a pharmacist, you'll get this letter. A pharmacist will reach out to you to see if you want to have a comprehensive medication review. So if you do not get one of these letters and you still want to talk to your pharmacist, we can do that. There's an 800 number on the screen. So when we go over all of your history, all your medications, prescription, over the counter vitamins, and go through and look for ways to make sure there's no overlap, like Dr. Garg was saying. Make sure you can manage your side effects if you're having any, and maybe ways to save. Thank you. I'm going to pass it back on to Ryan now to close us out.
All right. Well, thanks, Danielle, and thanks to all of our panelists. We're about 2 minutes from the top of the hour. There was a lot of content there, a lot of valuable information. I know the Q&A has been pretty active, and also thank you to Wendy, kind of behind the scenes here, answering a lot of those questions. Again, there's some helpful links and reference material. Do want to just slot in a couple questions here. The first one, and maybe this is a good one for you, Tim. How do I take advantage of my benefits when traveling?
Oh, that is a good question. Usually when you're traveling, you're trying to have a good time, and the last thing you want to worry about is an accident. Well, when you are traveling, urgent care and emergency coverage is worldwide, so you're always protected. Now, on your ID card, you'll notice that you have a suitcase, the outline of a suitcase. That means your plan travels with you. So, like if I'm down in Florida and I see a doctor that participates with Florida Blue, I show them the card, they look at the suitcase, they know to just submit the claim to Florida Blue. So yeah, when you're traveling, the last thing you want to do is worry about whether, if something happens, are you still protected? And you are.
Yeah. And exactly. A lot of flexibility with the Advantage plans. Doesn't really matter what plan you're on, but essentially, if you're traveling, that urgent emergency benefit is going to be portable for you. So, great question and great summary there, Tim. I'm going to squeeze in one more question because we're right at the hour mark here. Let's go, Sarah. I had a question on Fit On, and I believe you referenced this, and I think there's a helpful note here in the Q&A portion of the chat. But how do I find a participating gym with Fit On? Can you reiterate that for us, please?
Sure, Ryan. So if you just want to look up a gym and see if they're participating, you can go to fitonhealth.com. And at the top, towards the top of the screen, there's a select fitness locations. And you just want to click on that. And from there, you can search gyms by name and zip code.
Awesome. Fantastic. And again, there is a link in the Q&A portion of the chat, just for quick reference. But we're 1 minute past the hour, so I will wrap up here today. But we truly hope you found this information helpful. There's a lot of material, a lot of content, and a lot of benefits for you. So there are 2 opportunities for you to share some feedback with us, and we certainly appreciate that feedback. First, after this session, you'll receive a post-event survey. It'll come to you via email where you can provide feedback and request additional support. Second, every year in the spring, some of our Medicare members are randomly selected to participate in a detailed satisfaction survey. It asks about your experience with the benefits, some of which we talked about today, and others, things like your ability to schedule doctor visits. Note, not everyone will get this survey every year, but if you do, please take a couple minutes, fill it out. Your feedback is truly what guides our company and the services that we provide here in the community. And with that, again, I want to thank our panelists. Fantastic webinar here today and virtual event, a lot of material. And thank you to all of you for attending, taking an hour out of your time. And we certainly hope you found this information helpful. So thank you and have a great day.